Hi everyone, this is not one of your normal videos. Today we are doing our shoot from Westlands Primary School, Bootcamp 2022. Parents out there, will start first by saying thank you so much for the amazing support and allowing your teenagers and preteens to come and walk the journey with our psychologists. My name is Triza Kaineka, Allsmiles Therapy Center, and we are here talking about our teens and preteens. We are starting all the way from 9 years up to 12 years, those are preteens. Then again, we have 13 years all the way to 17 years. This upcoming long holiday, parents, bring all your kids. Let them walk a journey with us, our psychologists, as their life mentors in their life. So what exactly are we talking about? Boys to men, male circumcision. Here we come to you, presenting the 10-day boot camp. Karibuni.
We're back again. And now this time we are joined by Dr. Kemani. He'll be introducing himself. As we said, for this 2022 boot camp, we are running 2 events at a go. We have the first one where we are taking preteens all the way from 9 years to 12 years. Then again, we have teenagers from 13 years all the way to 17 years. And at the same time, apart from having the boys and girls, we also have male circumcision, which in another word we are calling it boys to men. So Dr.
Yes.
Kindly introduce yourself to our viewers, our parents out there. Yes.
I'm Ibrahim Kimani. I'm delighted to be sharing the information concerning circumcision with you, and I hope we'll have a beautiful interaction.
Wow.
Yes.
Tell us what circumcision is.
Well, circumcision, let me narrow it to male circumcision.
Yes, male circumcision.
Yes. So male circumcision simply, it's a surgical procedure, a minor surgical procedure that entails the removal of the foreskin of a penis. Basically, it's a minor procedure that lasts for between 5 to 10 minutes at most. And it is normally a procedure that bears very minimal complications. And in this, for this instance, the procedure is done in a way that we minimize the spillage of blood. We take care of the environment in that the infections will be coming in around, and the healing period will also be shortened. In short, it's a surgical procedure that is accepted. It's worldwide accepted actually, and most of the countries, many countries actually prefer circumcision to other forms of the transition to manhood for the boys.
You've mentioned about a procedure that is a surgical procedure. What's the difference between this particular surgical procedure and the one we get to know, or someone is going through surgery?
Okay.
Is there a difference?
Yes, there's a difference, and in surgery we have minor and major surgeries. When you're talking about a major surgery, this is where you have to be in theater. We have to give you general anesthesia for you to be asleep for the entire time that you're being done the surgery. But for the circumcision, being a minor surgery, can be done in any other place apart from the theater, as long as the place is clean and all the safety precautions have been taken, have been put into place. Here we give painkillers in that we localize the area. It's a local area localization. Like we are not, for example, during the circumcision, we are not giving you a general anesthesia whereby you're sleeping for the entire time. It's just the place that you're working on, the penile. We numb it so that there's no pain. You cannot be you're not feeling any pain. The procedure is painless, basically. So that's the difference. The major and the minor is just the place you're doing it and the presence of the general anesthesia or not.
Okay, so the procedure is painless.
Yes, it's a painless procedure.
Because you give them, and you've said it's painkillers.
Okay, it's in the layman's language painkiller, but it's anesthesia. We are numbing the area so that you not get the sensation for pain. Mm-hmm. Yes, so that you cannot be able to feel pain, you cannot be able to feel touch around that area. So the procedure to be a little bit conducive for the person we're doing on.
Wow. Now, Daktari, we are getting many questions from parents.
Yes.
So you can tell us, now that you've explained to us what circumcision is, the management, the pain management thereafter.
Okay.
At the same time, how long it takes to heal.
All right.
And at what point do you say that this person is healed completely? And also the, do's and don'ts during or immediately after the procedure.
Well, after, as we said, we'll localize the area and we'll give local injections to make sure that there is no pain during the procedure. The medication that we normally use, it's going to last for approximately between 45 and 1 hour. After that, you might be getting some little bit of pain here and there because it's a tissue and has been cut, subjected to a lot of trauma, and you are expected to at least you're expected to heal without pain. So in this instance, we'll administer painkillers, oral painkillers that will be taken for the entire time. But this one also, approximately by the second day, the pain will have disappeared. What you'll be getting after that probably is a little bit of itchiness, a little bit of, for example, when you're going for a short call, you'll be getting some irritation, a little bit of that. But basically, by the third day, you're supposed to be out of pain. Okay. But in case that there's pain even by the third day, we also advocate for other types of medications and painkillers. On top of that, to prevent the infection, you'll also be on very effective antibiotics. The antibiotics normally prevent infection and bacterial infections that normally cause a building up of pus around that area. And it's a sensitive area, as we can agree. So we don't want to subject it to a lot of to take a lot of time before it heals. Tentatively, the healing period differs from one person to the other because of many other factors. But basically, in normal circumstances, by the third day, we can be able to assess and probably point 1, 2, or 3 things concerning the healing and be able to predict. Probably this one will heal more than faster than the other one. But by the third day, you're supposed at least to have started healing. We'll examine the area and we'll be able to tell if they are good. There's something called granulation tissue. The place is healing well, and the presence of pus, of course, that is a sign of an infection. And just to mention that I mentioned about infection, for the people, for the patients who will be undergoing the procedure, it's good to understand when we say that there's an infection. When the area becomes so painful, tender to touch, like it's touch and it's very painful, becomes a little bit red on the margins, or it's oozing pus, or it's very hot on touch, that is a sign of infection. So when such a thing happens, it's good to inform the guardian or the doctor who's around there. And yes, so going forward on the healing part, by the 10th day, at least someone is supposed to have. Normally, when due to the normal healing process, there's something called eschar that normally forms on top of a wound. These are dead tissues of inflammatory process that normally covers the area when healing is happening below it. So by the 10th day, that hard area, black area, is supposed to fall off. And nowadays, the techniques normally used, we don't use non-absorbable sutures. We use absorbable sutures. By this I mean, when you do the procedure, we'll use sutures, or rather the suturing materials, the suturing materials that are absorbable. We won't have a need of removing them later on. So in this case, by the 10th day, you'll have a clean, healing wound that is free of sutures that are coming out because they are burrowed inside the tissues. And by the 15th day, I think that is a person that is completely healed. Only that now after surgery, you need to take precautions. Now that is a place that is still weak, the tissues are still weak. When subjected to a lot of trauma, you'll probably maybe bruise yourself and bleed because the skin is still weak. Yes. And something else maybe to mention about immediately after circumcision, there is the patient will notice a difference in when, for example, going for a short call. Now that the place has been inflamed, a little bit swollen, you will be having a little bit of difficulty when you're going for a short walk. It's agitating and a little bit of pain. But that one will wear off with time, and also you'll realize that your glands will be so sensitive and will start peeling off. That is just one of the things that will wear off with time. It doesn't have to be the first week, maybe the second week. Sensitivity can even take 3 weeks. But basically by the 10th day, the patient is good.
Okay. Yeah. Wow, thank you, Daktari. That's very, very much informative. And now we know, including myself, we are being asked some of these questions and not knowing how to answer. That's why we had to bring you on board for parents to get to know. Okay. And because we'll have them here for 10 days, so that means by the time we are releasing them back to their parents, they will already be healed.
Yes, definitely. Yes.
Wow. Now, another question we are getting is if you're going to use the most recent system, I don't know whether you call it system or the methodology, and maybe you can explain more about that.
That's a very good question, because everybody would love to have a procedure that is done with precision, procedure that's done in a septic environment, in a place that is clean. So, for instance, we've moved a notch higher in terms of when it comes to circumcision, and nowadays we don't subject our patients to a lot of waiting time during the procedure. There are new techniques of doing it that minimize the spillage of blood. Actually, just a little bit of staining kidogo, just drops of blood that will be lost within the operation time. So we minimize that, and also we make sure that, because the more you take time with a minor surgery, the more you bring anxiety to the patient. So in this case, it's going to be a very, 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 very there's a lot of precision in it. It's going to be fast, and before you realize it, we are done with the operation. So we are employing all the high-notch modern techniques when it comes to circumcision. The traditional ones are a little bit outdated, and they've been associated with a lot of infections and delayed healing. So for this instance, I don't think that's something to worry about.
Great. And you've said it's a very fast procedure. How many hours, minutes?
Not hours.
Okay.
I think when we can't go more than 10 minutes, 10 to 15 minutes actually. But this one is between when we meet the patient up to the time I'm dressing the patient. But the cutting itself, it's approximately 2 to 3 minutes. You're done in the cutting. You put some sutures within 2 minutes, and you're done. So the surgery itself, the surgical part, can give you 5 minutes.
Oh,
yes!
Wow, 5 minutes, and now you're done.
Yes.
Now tell us of any complications and the worst case scenario, because you've done this for so long.
Yes.
And it's also good to get to hear from the experience and how you go about it, how you navigate the risk, and how you plan to ensure that does not occur.
Okay. For starters, for any patient apart from the circumcision issues, so there is the history part. We actually, this is good for the parents also to know. That is important when you bring your kid, at least for us to know some background in terms of any pre-existing conditions. Like there are conditions that normally delay blood clotting, like the hemophilia, blood-related disorders. It's good to let us know so that we can be able to plan for a more concentrated surgery, the minor surgery. But in this case, if, for example, there are those disorders, that one will have to involve other specialists in the same area for us to have an effective surgery. That is it. And if the patient is taking drugs, if there are drugs that have been taken for any time, any amount of time, more than a month, 2 months, it's good to let us know, because the other drugs can delay healing, can increase the rate of infections. Yes. So onto that. There are complications, but I don't think they are major ones. The most complication is infection after the surgery, and we say that it's going to be an aseptic procedure. We are going to ensure all the protocols of cleanliness and the environment is clean. The materials you're using, they are sterilized, very much sterilized. Actually, the sterilities are just on another level. And you use different packs for different patients. You're not going to use, Kitambo used to have these stories of, using the same equipment. But nowadays, that one is not there. So you're going to use differently packed, super sterilized equipments that are going to be done on each, not on all, using the same. Then, the other complication is maybe the bleeding that I've talked about. But the bleeding part, it's minimal. We've not encountered so much of bleeding unless there's a pre-existing condition, and if there's such, we have specialists, super specialists in that area that are going to address the issue, and we can opt to do it in a major theater, whereby you have other equipment that are going to address the bleeding faster. The other complications probably they are related to the patient who is healing. Maybe the patient went, and because the patient by the third day you're painless and you can jump up and play football, maybe rupture, and we come and we repair. So that is a precaution, and I don't think it's not related to us. Probably it's a precaution that the patient can take. When you're done the procedure, just try to relax. It's not for long. It's just for a period. You just try to minimize the activities. At the end of the day, you need to heal with minimal movements, so that by the 10th day you're good. You are not prolonging the healing time. Yeah, those are just some of the known complications that you've encountered. But basically, it's something that is a very safe surgery. We've not seen serious issues. People don't die during the procedure. I mean, it's good. It's something that can be addressed quickly. And if there's a complication, I've never seen somebody going overboard in terms of complicating to an extent of requiring very serious interventions. It is simple.
Wow, good information for parents out there to note. And still, we'll have doctors or nurses on call and on site throughout.
Yes.
So does this mean it's only purely for management? Because after the surgery, do you require them to come back, or?
We are once we do the surgery, we'll be able to take you through the healing. The nurse will be around to take you through the healing process and trying to explain to you the signs that you're feeling. By the third day, the nurse will also be around there to address the issues of healing and all that. But also the doctors will be around in case there's an issue. The nurses will be able to inform the doctors, and they'll be able to address the issue. And in case there's anything that comes around that probably you've not, the nurse can be able to fail to pick, maybe we'll ask the patients to maybe shout it out, so that we may be able to address the issue. But basically, the major issue that probably we anticipate in this area, it is purely pain. Maybe pain. That's when that is what the most common complaint that we have from the patient. Hey, daktari nasikia uchungu hapa. That can be addressed easily. So the doctors will be there. The nurses will be with the patient for the entire time. So the safety and the management, medical management, is really covered well. So yeah.
Wow, and you've had, because of course we'll have other team here for Bootcamp, so for the circumcised boys, you will not participate in our team building, our morning exercise and running activities. That has come from the doctor, not from ourselves, because definitely we need to be more precautious and we need to ensure that the healing is done the right way. So now, Daktari, tell us more about circumcision, as a perception, because we have some people who say it's outdated or it's more tradition, or from our side we don't go about it. So is it medically correct, or is it done because it's traditional, or because we are Africans? And is it also done out there by Westerns?
Okay, that's a good question. Circumcision basically in the African setting, for the Wazungus, maybe I cannot speak about them so much because I've not been there so long. Okay. So let me just squarely speak about the African society. we have different mentality towards it, but the major perception surrounding circumcision is getting to know that you're from a boy to a man, which is also surrounded by many other issues, because also in Kenya we have different communities that don't support the male circumcision. So medically, it has been proven that it has more than enough advantages. Number one, you're less likely to develop STIs, including HIV. There's a research that was done in Kenya actually that revealed that men who are circumcised, they have the rate of contracting HIV is on the lower side in comparison to the other people that have not been circumcised. So there's a very huge. I'm not saying that you'll be promiscuous, but I'm saying there is that advantage that comes with it. Secondly, there is, of course, the rate of contracting penile cancers. Another research was done and revealed that the penile cancers were more on men that were not circumcised more than the people that have been circumcised. The other one, basically, it's hygiene. You know, the penile, the glands, around the glands area, it's covered, it's moist most of the times, and you'll be experiencing a lot of smegma. Smegma is the whitish discharge that normally comes from that area. So it's a little bit, it's hygienic. I mean, of course, and the benefits outweigh the bad part of it. And then maybe before that, let me just talk on indications of circumcision. There are those circumcision. The circumcision is dependent on why it's being done. For example, there are medical reasons why you can do circumcision. When there's an infection or rather something called phimosis around the penis cannot retract. It's just tied, and there's a lot of resistance up and belly, so you cannot be able to go for a short call well. So the other indications of religion that are based on religion, the other religions that normally do very early, the other religions that demand that you have to be, it's like a religious practice. Also the African tradition when the transition from a boy to a man. So basically the acceptance, where we are headed right now, the WHO, many organizations, international organizations, they are advocating for circumcision because the benefits are enormous. And when you do circumcision, you're able to reduce many complications that might come later on. So yes, so the perception, they are the people that have a different perception about circumcision, but basically there is a lot of benefit that comes along with circumcision. So yes, that is it.
Oh wow, we have this question that has been asked by several parents, if they will be allowed in during the procedure.
Right.
And completely, we had to call and consult because we do not know. So maybe you can enlighten them more on that.
Okay, so being surgery, we normally minimize the number of people that are coming in because of the infection, and that one might delay the healing process. So in this case, we'll really want probably one person to be around the patient, and this person probably a relative, maybe a cousin, maybe an uncle. In African tradition, I've seen uncles coming along with the patient. Nevertheless, there are special considerations. I think those are things that can handle that.
A dad?
Well, a dad is debatable, a little bit debatable because maybe the patient might have different opinion about that. But that's something that can be, the patient can be asked, are you comfortable? If they're comfortable, we can go ahead. That's your kid.
Okay.
Yes, so you can just go ahead.
So
but the mom, sisters, I think that is a little bit sensitive.
Okay.
Yeah.
So moms and sisters and aunties, all female relatives you've had. Daktari has said clearly that you won't be allowed in during the procedure, but of course you can escort and wait for the boy after.
Yes.
But not in. However, for the dad, male cousins, uncles, if the boy allows. That is, if the patient allows. So in this case, seems like it's, it has turned. It's now the patient to give consent if they are comfortable.
Yes, you cannot, sometimes you're like, sasa, baba yangu, nitakuwa namuona. Some boys, they have different perceptions toward these things.
Yes.
And these are private issues. When they're dealing with that area, I think everybody has some sort of rules that surround what is supposed to be norm. So I think in this instances, when it comes to dad, I'm talking about dad, the patient will decide.
Okay.
Yeah.
Wow, Doctor, anything else we need to know about circumcision and what will be taking place?
Basically, that is it. But majorly, maybe summarize and capture some few things we talked about. It's a pain-free ordeal. You're not subjected to any kind of trauma. Sio mateso, hakuna mtu anakutesa. It is squarely a very clean procedure. It is done. There's something called healing with primary intention, meaning that we cut, knowing that the area is very clean, so minimize a lot of infections. You would be having bleeding. You are not going to bleed during the procedure. The procedure we are going to use very modern equipment during the cutting. We are going to use super sterilized equipment that are actually not sharing. After we are done with that, with you, the equipment are done. Then will be others. So you are going to assure you that contracting, there is these issues of maybe you've had somewhere else. We're using the same equipment to patients. So in this instance, we're going to use different patients, different equipments for every particular patient. So yeah, after that, we're going to monitor you for the entire time. From the time we do the circumcision, up to the time that you're leaving this place, we'll ensure that you're going home a healed person. And in case there is anything around, we'll be able to address it as early. We won't be waiting for complications. We'll address it early so that you might be able to. Christmas is almost around the corner. They play Christmas vizuri. So I think basically, unless there's any other thing,
wow,
that's it.
Thank you so much, Daktari.
Yes.
I want to believe now all the doubts, they are over. And definitely the parents, they are going to bring their boys for circumcision. So don't forget, circumcision will be taking place. And at the same time, our psychologists will be on board to ensure that we take through the boys the psychological training, a lot of things. Of course, we'll be mentioning some of them. So bring them. There is a great benefit to have them and to have this process done professionally.
Yes.
Yeah, so thank you so much, Daktari.
Thank you too for having me around.
Okay.
Well, here we are with Madam Grace. She's the matron, Westlands Primary. So she will be taking us through where our kids, the preteens and teens, including the boys coming for circumcision, where we will host them for the next 10 days. So Madam Grace, thank you so much, and especially for hosting us. We know especially this time you are preparing for the exams, and of course we wish them all the best. So yeah, you can talk to our parents and introduce this wonderful place.
Hi parents, hope that at home you are doing well. We are also fine, although very busy preparing for our exams from tomorrow to Wednesday. We are happy to host you. We love visitors. Karibuni sana. This is where we are going to host our children, and we'll lead you inside. You see how it looks like. It's a beautiful place. You'll love it. You're welcome.
Thank you.
Okay, this is our dormitory for the girls. These are the cubes. We sleep 4 per room. And this is how it looks. It's a beautiful place to be. We have cleaners. Security is tight. We have security here and in the entire school. So we have 4 security guards roaming around.
Wow.
Then this is our corridors.
Thank you so much. All the best in your exams.
They have butterflies in their stomach now, I know. These are our bathrooms. As you can see, they are well maintained. These are our sinks. These are our toilets. It's a very unique place, a very equipped place. It's very clean because we have cleaners around. We use everything to make this place clean. How do you see it, madam?
Oh, it's very, very clean and very modernized. You can't actually tell. Maybe you can take one for the toilet. You can't actually tell these are school bathrooms.
Yeah.
You absolutely can't.
This is how we maintain our girls. This is the dormitory for girls. We'll go upstairs and see the boys.
For the boys.
Yeah.
Oh,
See
that's
how
great.
it is. So these are.
So this is the floor where we host our boys. And guess what? Where I'm standing, this is going to be the doctor's room. So we're going to label this doctor's room, and even nurses on duty, they will all be here, awaiting just in case of anything for any medical inquiries and all that. So this is the floor we're going to host our boys, and even the ones who are going through circumcision. So Matron, Madam Grace will be showing us now the boys' room.
So this is where our boys will be sleeping. Each per bed. We don't share beds in Westlands. We have enough beds, we have enough rooms for our children. So Bwana Daktari, how do you see it?
Yeah, it's a good healing area, and I think it's going to service for our boys. And yeah, it's a good place.
It's a good place.
Yes.
You're welcome.
Oh, so, yeah. And for circumcision, there will actually be only 2 per room. You know, to ensure, because of course we know you mentioned about the safety and everything.
Minimal activities, I think getting the lower bed is important.
It's the best.
Because one cannot be go to the airport of the pains.
Exactly. Yeah, but for the rest again, it's 4 per room, because of course we have others who will be joining because of the boot camp.
Yes.
So once again, Madam Grace, we will not, tire to tell you thank you so much, and this is a very wonderful setup.
Karibu sana.
Yeah.
You're so welcome.
So maybe we can go to a place where they will be relaxing upstairs
and having their sun.
Yeah, sure.
Okay, this is the top roof of our dormitory, Westlands complex. Although we don't allow our children to come up here, but for this, Bwana Daktari will tell us why sun is essential for healing of our children.
Definitely, sun is a very important component when it comes to healing. And having such a wonderful place for the boys to rest, I think is a plus, and it's going to minimize the days of staying around this place. It's going to do well in terms of minimizing reducing the inflammatory issues around the circumcised area, and the boys will really enjoy a shortened time of after the surgery, that is. Yes.
So as you can see, parents, we are ready to move. We are waiting for 7th to start this camp. We are anxiously waiting for your children to come here. Wamekaribishwa sana, and through the management of Westlands Primary School, the administration, our principal, the teachers, they are very happy to host you guys here. So karibuni sana, mjisikie mko nyumbani.
So parents out there, now you see where we'll be hosting your daughters and sons from 7th up to 17th of December for our boot camp. And yes, we shall be also having male circumcision taking place. And as you can see, the environment and the area, how it looks like. So because doctor has taken us through the process of circumcision, let me remind you that we are hitting 2 birds with 1 stone. So yes, we are going to have the circumcision for the boys who are ready for the rite of passage, which is circumcision. At the same time, we are hosting. Most of these boys, they are even circumcised. They're both circumcised, and we'll also have the girls. So it's your daughters and your sons from 9 years all the way to 17 years. Bring them here, let them walk the journey of life with our psychologists. This is going to be a holiday on holiday. So here I'll be mentioning some of the things that we're going to take them through. And this is, of course, they will report for the boys going through circumcision. They will report on 7th, and the process will take place. The doctor will advise, and of course will communicate to the parents either on 7th in the evening or early morning on 8th. Thereafter, the rest who will be coming for the boot camp, they are going to join us on 8th at 3 p.m. And of course, we'll have some introduction, some entertainment going on and getting to know who is who, onboarding them here for the ones who are going to be boarding all through. And just to mention, even for parents who wish to drop and pick their kids, yes, it's allowed. So not just for boarding. If you're within Nairobi, within Westlands, you can still choose to be coming, dropping them in the morning and picking them. So our program by our psychologists, Allsmiles Therapy Center, will start right from 9. And day 1, we'll be looking at adolescence and puberty, self-awareness, peer pressure, social skills, emotional and physical body changes. We'll also be looking at sex, recreation, early pregnancy, stress, boundaries, attachments, gambling, drugs and substance use. We'll also be looking at self-esteem, effective communication, how to call out for help, positive coping mechanism, how to overcome bullying and assertiveness. We'll also be looking at support system, self-care, personal hygiene, first aid, basic home science, and of course, there will be more of cooking and baking taught here. We'll also be looking at the academic excellence, family, technology, and social media interactions, sports and team building activities. So these are the activities that will be taking place for the entire 10 days. And now for sports and team building activities, this won't apply to the boys who will be circumcised. This will now be for the rest of the team. We'll have a gym instructor to ensure that in the morning, our nerves, they are well awakened and ready to start the day, as well as also in the evening. And also, we shall be having our closing ceremony, which will take place on 17th December. And all the parents and other invited guests, you are all invited to come. During that day, we'll have our psychologists deliver a talk to you, which will be all about child-parent connection, child-parent emotional connection. So we'll be taking you through to get to know about emotional needs of our kids and how to meet them. Also, how to connect with our kids emotionally. So my name is Triza Kaineka, and once again, today being 27th of November 2022, I take this opportunity to wish Westlands Primary School Class 6 and Class 8 all the best in their coming exams, and also even for our candidates for this boot camp. You are out there preparing to come. We wish you all the best for the ones who are sitting for the exams, KCP and KCSE, not to forget the entire country, Kenya, all our candidates across the nation for Class 6, Class 8, and Form 4. We wish you all the best in the upcoming exam. Thank you so much. Continue supporting us, Allsmiles Therapy Center. We are here for all your mental health awareness. Thank you for the people who come for our counseling services. Our office is not based, it's based not far from here at Westlands Woodvale Group, Vigilance Center, first floor. We see clients from Monday to Saturday and even at night on arrangement on Sundays and public holidays. Come, let's continue doing this. As we said, our services start from as little as 3,000 bob per session. Come and let's walk the journey of mental health with you. Thank you so much, and we look forward to host you and to have you next. Till then, bye-bye.